I have a very long-standing relationship with Barcelona. I lived there for many years, actually. And before I came back to the United States, I've been here for about 4 years. I had the good fortune to start working with Dr. Giuseppe Planas, who is the director of the palliative care program in the Hospital del Mar, El Parc Salud del Mar. And also with a wonderful music therapist, Nuria Escudé, who is now in charge of a music therapy program, a pioneering program in Spain, in Dr. Planas' Department of Palliative Care. She studied
My history with music therapy begins when Professor Rossetti, at the end of 2010, presented to me his project of music therapy in advanced cancer patients. His great interest and the quality of his program impacted on my initial suspicions. A few days later, we began to work seriously in the development of our project, and my interest of non-pharmacological therapy for treatment of patients with cancer was born.
I work with all of the patients that come in for radiation therapy in this hospital on an individual basis, and we address many different areas of patients' needs. They could be psychological, psychosocial, emotional, physical, or spiritual needs, actually.
Fortunately, Andrew contacted with Professor Nuria Escudé, director of the Master of Music Therapy of the University of Barcelona, and she agreed to join our project.
I've been working with Dr. Planas at the Hospital Esperanza as a music therapy for the last 3 years, even though I can be very hard at times. I have found working with people with terminal illnesses to be a very rewarding experience.
Up until December 2013, we have received 144 patients with an average of 4 sessions of music therapy per patient. Professor Escudé will talk in detail about our method of work.
I'd like to show you some of the techniques we apply in the PCU. These techniques are designed to be stimulating and interactive for the patients. Singing songs, improvisation, songwritings. We also use techniques designed to help the patients relax and meditation, particularly with patients in a lot of pain.
Data collected in the first session included in all patients physical and emotional symptoms, the H scale, well-being, and Pfeiffer index. In cases, music history and vital signs were also assessed. We suggest that further studies in clinical research are needed to promote strong evidence of effect of music therapy in palliative care patients. In conclusion, we believe in music therapy in terminal or advanced cancer patients, but it's necessary make a great number of scientific studies for improve the evidence of this non-pharmacological treatment. And only said, thank you very much for your attention and comprehension.
Just that it is a absolute pleasure to continue working with Dr. Planas and Ms. Escudé.
Golpe a golpe, verso a verso, golpe a golpe.